Today's video is a little bit different. I'm not going to talk about products and product reviews in this video. Instead, I wanted to give you a literal skincare guide of all the skincare ingredients and corresponding skin issues that they are particularly well designed and well suited for. I'm going to go over the best suited ingredients for acne, hyperpigmentation, scarring, redness, dry skin, and of course anti-aging. That way you can extrapolate based on the skin issues you're dealing with what kinds of ingredients or products might be best suited for you, and then ask away in the comments for any product recommendations from myself, but more importantly our skincare community. They're great at throwing in their own advice and experiences that you can read through and also gain a lot of knowledge from. Disclaimer, I'm not a doctor or a dermatologist or a medical professional, simply a skincare enthusiast who's dealt with skin issues in the past, and I'm simply giving you my perspective and based on the things that I've researched myself. With that said, let's get into it, starting with acne. To be honest, I was actually very surprised because I struggled with acne more in my 40s than I ever did in my teenage years. That to say that you can experience acne throughout your lifetime and to not be surprised if it crops up at an age that you're not expecting it. And it's important to get to the root cause of what is actually causing your acne. Part of my acne troubles are directly linked to my rosacea. I have combination skin that's also sensitive and rosacea prone, but we're also going to touch on redness and rosacea in this video, so just stay tuned. Tried and true products that really are meant to target acne, starting out with benzoyl peroxide. Typically, medical professionals recommend that a 5% benzoyl peroxide is suitable for the face, whereas you can go up to a 10% for the body. And don't forget that some people are dealing with acne in other places, not just the face. Could be on your chest, your back. Sometimes in the summer months, that's where I'm dealing with acne. Salicylic acid is another great ingredient for acne. It is a BHA or a beta hydroxy acid, and salicylic acid is great because it gives a gentle exfoliation. It helps to unclog your pores and remove that oil from the pores. So you can see how it can be very helpful for acne and especially oily prone skin. You can find salicylic acid in a variety of products. It can be found in cleansers, in serums, in toners. So it's really about finding the right product for you. Retinoids. I've done a full video on retinoids. If you haven't seen it already, I'll link it at the end of this video because it really does a deep dive into all things retinoids, because retinoids as a family are quite confusing. And many people think of retinoids simply for anti-aging, but they were actually developed with acne in mind initially, and it was only through subsequent clinical trials that they noticed, hey, this also helps the look of fine lines and wrinkles. So using retinoids as part of your acne strategy is definitely a great idea. Azelaic acid is a completely underrated ingredient in my opinion and has great skin benefits for acne. Azelaic acid is a naturally formed acid that can be found derived from wheat, rye, barley, and it has antimicrobial and anti-inflammatory properties. This can help prevent future outbreaks and also helps to clean the bacteria or remove the bacteria from your pores, preventing future outbreaks. And we can't discount the need for some people with severe forms of acne to require some kind of oral medication. Isotretinoin, or otherwise known as Accutane, might be an option for many of you. Contraceptives are sometimes used, and even antibiotics. I would love to hear from those of you in the comments who are comfortable sharing your experience. I have not had to take any of those types of oral medications, so I can't really speak to it, but I'd love to hear from those of you who have, or perhaps know someone who has, who could give some insight in the comments below for people who are looking for that kind of support. And here you go. Next, let's talk about pigmentation. First off, there is no magic bullet when it comes to pigmentation. Pigmentation is a very difficult thing to address with topical solutions alone. And there are many different types of pigmentation issues, hyperpigmentation or post-inflammatory hyperpigmentation or melasma, just to name a few. So depending on what type of pigmentation issue you're having, it can also impact the type of solution you're looking for as well, and a realistic view on how far topical applications, skincare products, or solutions can take you alone. But there are some key products and skincare ingredients that the skincare community agrees on are very beneficial for those of you dealing with pigmentation. Hydroquinone is a medicated cream that needs to be under the supervision of a medical professional, and it's not without its controversy, especially for its safety profile. In 2020, the FDA actually banned it from over-the-counter use. Arbutin is another one that you'll see in many skincare products, and it is actually considered a plant-derived derivative of hydroquinone, therefore having some of the similar capabilities but not to the same extent. and basically it's thought to inhibit tyrosinase activity. Tyrosinase is responsible for melanin production in the skin, which in turn will cause the pigmentation of your skin. Acids like AHAs or alpha hydroxy acids, different from the salicylic acid that we talked about before, things like glycolic acid and lactic acid specifically, are really great to target brightening and reducing hyperpigmentation in the skin because they slough off that surface dead skin cells and debris, revealing smoother, brighter skin underneath. Azelaic acid, like I mentioned for acne, also has very subtle exfoliating properties which make it ideal for those of us with very sensitive skin that maybe can't tolerate some of the other AHAs like a glycolic acid. So it really has a lowered risk of irritation, which is great for hyperpigmentation. Of note, when you have highly irritated skin and you're using products that really irritate the skin, that can in turn cause hyperpigmentation because the inflammation can leave that hyperpigmentation behind. So it's a very delicate, fine balance. Vitamin C is a known skin brightener. It's also a powerful antioxidant that can help protect your skin, and it's known for its collagen-inducing properties, which also make it great for anti-aging. So a great kind of all-in-one serum to incorporate into your routine if you can tolerate it. Kojic acid is another acid that's often used in hyperpigmentation targeted serums, and it really works to also inhibit that tyrosinase, which is responsible for the melanin production in the skin. Speaking of retinoids, again, not only good for acne, for anti-aging, they can also be good for hyperpigmentation because it can be very powerful in targeting melasma and reducing post-inflammatory hyperpigmentation. And of course, we know retinoids are just the gold standard when it comes to anti-aging. Licorice extract and a number of plant-based extracts also hold some really important qualities that could assist with the reduction of hyperpigmentation. It's just more studies need to be done, although for licorice root extract, there are some studies that really do support its efficacy. NAG, which is short for N-acetylglucosamine, is also another great product to incorporate if you're dealing with hyperpigmentation. It can reduce the amount of melanin in the melanocytes in your skin, which in turn can improve hyperpigmentation and just in general improve your overall skin tone and texture. Steroid creams, again in consultation with a medical professional, can help to reduce dark spots or lighten the skin overall. And superficial chemical peels that can be done by a medical esthetician or in a spa, similar to what we talked about with the glycolic acid and your AHAs, just take it to the next level. These can also be really good at targeting aging as well because it can help reduce the look of your fine lines and wrinkles, but overall are meant to remove a superficial layer of skin, revealing brighter, newer skin cells underneath. Lasers and resurfacing treatments also have a place in targeting hyperpigmentation, and of course it's very important with any of these spa procedures or medical procedures that you're going to someone you trust. Lasers can treat a variety of types of hyperpigmentation and on a variety of types of skin tones. And sunscreen, of course, is one of the best things you can do for hyperpigmentation to prevent future hyperpigmentation from happening. The sun's damaging rays are directly responsible for causing these lovely age spots that I have on my skin. So using a daily sunscreen as the last step in your morning skincare routine every single day really helps to protect you from future skin damage. And here you go. Similar to hyperpigmentation, if you're dealing with scarring on your skin, you can leverage a lot of the same products and procedures that I just talked about to target hyperpigmentation, but some additional ones to note. With respect to retinoids, you just might need a higher strength form of a retinoid to be able to target scarring. Versus the superficial chemical peel we talked about with hyperpigmentation for scarring, you may need a deep chemical peel, which is of course more involved, has longer side effects and a longer recovery time, but can be very effective in dealing with scarring as well. Lasers, again, very effective, and microneedling can also be another solution for those of you dealing with acne scars. Microneedling can improve the skin texture because that sort of damage or inflammation the needle is causing to the skin actually provokes collagen production, which will help address the scar from within. Of course, also good for anti-aging as well, and there's some nice studies to prove its efficacy as well. Subcision is another procedure. It's actually a surgical procedure where a needle is used to break down the scar tissue within the skin. This causes the acne scar to depress, and then oftentimes dermal filler is used to sort of plump that area up. So those two in combination, very common for acne scars. And some medical professionals may even recommend steroid injections, which help to reduce the scar tissue beneath the skin. All of these, of course, would be in consultation with a medical professional to determine which solution or treatment is best suited to the type of scarring that you have. And here you go. Redness is something I can definitely speak to, having dealt with rosacea. I have to start with azelaic acid. I spoke about it with respect to acne and hyperpigmentation. It's also got really great benefits for rosacea. Many dermatologists will use this sort of as their first line of defense when dealing with patients with rosacea, and I myself have had experience using over-the-counter azelaic acid products as well as prescription. I've seen immense benefits from using both over-the-counter and prescription strength azelaic acid. Truly a game changer for my rosacea skin. Niacinamide is also a great ingredient for rosacea or redness because it has anti-redness properties around it, anti-inflammatory properties, in addition to anti-aging properties. Resveratrol is another great ingredient. It's a powerful antioxidant that also has anti-inflammatory and antibacterial properties, which really help with that rosacea, redness, and the associated acne, pimples, etc. that can come with rosacea as well. Sometimes sulfur products can be used, as well as topical antibiotics in some cases. In some cases of rosacea specifically, oral medication can be prescribed. There isn't really one subtype of rosacea, there's many. So depending on what you have and what type of redness you're trying to target, the solution needs to be tailor-made for that particular thing. But something to really focus on if you're dealing with redness and rosacea is to maintain and preserve your skin barrier at all costs. Part of the problem with rosacea is that it is a damaged skin barrier. So a damaged skin barrier means that your skin's not able to retain moisture in the skin, very prone to transepidermal water loss. So maintaining and prioritizing the skin barrier has been one of the number one things that I weave through all my skincare routines to help my rosacea. So using hydrating cleansers, moisturizers that are rich in ceramides or glycerin that are really hydrating ingredients, humectants like hyaluronic acid, and also leveraging the power of calming and soothing ingredients like Centella asiatica, chamomile, aloe. These types of things can really help calm and soothe the skin, which in turn helps to preserve that skin barrier. And here you go. Continuing on the conversation of hydration, dry skin can also benefit from a lot of the same products we just talked about, including glycerin and ceramides to hydrate the skin, but also using occlusive barriers like petrolatum can be very helpful to lock that moisture into the skin. Another ingredient that's really great for dry and dehydrated skin is urea. Urea is an underrated skincare ingredient as well, and it has really great moisturizing and soothing capabilities, as well as some very light exfoliating properties. So its ability to both moisturize and even out the skin tone and texture is really great. You can often find urea in products that are specifically designed for psoriasis. And here you go. I hope you found this video helpful and you can use it as a reference point maybe when you're looking at a product and see ingredients that perhaps we've talked about today and you're just not quite sure what they're actually best suited for. Share this video if there's someone else you know that is really dealing with some skin issues, perhaps new to skincare, and is completely overwhelmed like I was when I first started out with skincare. Drop your comments, questions, and thoughts below. As always, I look forward to reading them in the comments section, and be sure to watch these videos next, and I hope you have a fabulous day.